Hi, my name's James. I'm a paramedic. How can I help you today?
Hi, James. I'm having a sharp pain in my chest. It started suddenly about 30 minutes ago, and I'm feeling dizzy and short of breath.
All right. I can tell that your airway is patent because you're talking to me and you're looking at me. Can you tell me, do you know where you are or do you know what the date is today?
Yes, I know where I am. I'm at home, and today is August 21st.
Excellent, thanks. What I'm going to quickly do is I'm going to just get some equipment onto you. So I'm going to check some of your vital signs. Is that all right? Do I have consent to touch and treat you as necessary?
Yes, you have my consent to touch and treat me. Please go ahead.
So while I'm doing this, I'm also going to just look at your breathing and how fast you're breathing. Can you tell me a bit more about your shortness of breath, please?
My breathing feels a bit labored, and I'm having trouble taking deep breaths. It's not as easy as usual, and it's making me more anxious.
Okay. So I can see that your saturation is a bit low. So I'm going to put you on some oxygen, okay?
Okay, that sounds good. I appreciate it.
So I'm just putting some nasal cannulas on, and I'm going to be putting it at about 3 or 4 liters per minute.
Got it. Thanks for setting that up.
So I've done your airway breathing. I'm just going to feel for your pulse.
Okay, I'm ready.
I'm going to just quickly listen to your chest. If you could just take some deep breaths in for me, please.
Sure. I'll take some deep breaths in.
Cool. So your chest is clear, which is good. Your saturations are improving. Is your breathing getting any better?
My breathing feels a bit easier now that I'm on the oxygen, but it's still not completely comfortable.
Great. So I'm just going to take some more of your vital signs, and then I'm going to just ask you a couple of questions before we start doing more things. All right?
That's fine. I'm ready for the questions and any additional checks.
Great. Can you just tell me about all of the signs and symptoms that you're feeling?
Sure. I have a sharp pain in the center of my chest that started suddenly. It's spreading to my left arm and neck. I'm feeling dizzy, short of breath, and anxious. The pain hasn't improved, even with rest.
Are you on any medications, or are you allergic to anything?
I'm not on any medications right now, and I don't have any known allergies.
Okay, so you're on no medications, and you are not allergic to anything. Can you tell me about any past medical history?
I don't have any major past medical history. I've generally been healthy and haven't had issues like heart disease or chronic conditions before.
Do you have any history of family heart conditions?
Father had a heart condition and suffered a heart attack a few years ago. Other than that, there isn't any significant family history of heart problems.
And the last time that you ate something or drank something?
I had a light lunch about 2 hours ago. Just a sandwich and some water.
Sandwich and some water. And
Got it?
and is there any significant events that happened previously?
No significant events recently. Nothing out of the ordinary has happened that I can think of.
All right, so there's some more questions I'm gonna ask, and then we're gonna probably start giving you some medication, and we're also gonna do an ECG.
Okay, I'm ready for your questions and the ECG.
So you said that this started half an hour ago. Is it getting worse? Is it getting better? Is it staying the same?
The pain is mostly staying the same. It hasn't really improved or gotten worse, but it's been consistently painful.
Can you tell me about the quality of the pain? What type?
The pain is sharp and feels like a heavy pressure right in the center of my chest. It's quite intense and also radiates to my left arm and neck.
And the severity, 1 to 10, 10 being the worst pain you've ever experienced, and 1 being almost no pain at all.
I'd rate the pain at about an 8. It's quite severe and makes it hard for me to focus on anything else.
All right, so I'm just going to quickly do an ECG. While I'm doing this, if you could just sit as still as possible, that would be great. We're going to do this so we can look at your heart.
Understood. I'll stay as still as possible.
How old are you? Sorry, how old are you?
I'm 55 years old.
Thanks. Just sit still for me, please.
Okay, I'm stopping now.
All right, so I see ST elevation in V3 and V4, so those are your anterior leads.
That sounds concerning. What will indicate? And what will be the next steps?
All right, so that's telling me that you're possibly having a heart attack. So what I'm going to do is I'm now going to start giving you some medications to try and treat that, and then we're going to get going to hospitals as quick as we can. Is that all right with you?
Yes, that's all right with me. I appreciate you taking care of this.
Great. So I'm going to just ask you some questions. Have you ever had aspirin, or have you had bleeding in your stomach previously or currently?
I haven't had aspirin recently, and I don't have any bleeding issues in my stomach or anywhere else.
Do you have asthma or kidney problems or liver problems?
No, I don't have asthma, kidney problems, or liver problems.
I'm just setting this to do a blood pressure every 5 minutes. So what I'm going to do is I'm going to give you a aspirin, and I'm going to ask you to chew and swallow it. You telling me that you aren't allergic to anything and that you have had aspirin before in the past, correct?
That's correct. I'm not allergic to anything, and I've taken aspirin before. I'll chew and swallow the aspirin now.
Great. So then the next medication we're going to be giving you is called GTN. So this is a little tablet that'll go underneath your tongue. Have you ever had it before?
No, I haven't had GTM before. What should I expect from it?
So just a quick, just a couple things. So you aren't running a tachy or Brady. You aren't hypotensive or anything like that. It isn't a inferior MI. And just another question is: have you or do you take Viagra, or have you taken Viagra within the last 24 to 48 hours? While you're busy thinking, I'm going to just prep for an IV line. All right. Cool. Sharp scratch in. Pain's all gone. Sharps away. Okay, just don't move your arm from me, please. All right, so I've just put up an IV line. You were busy telling me about whether you take any Viagra.
I don't take Viagra or similar medications. Thank you for setting up the IV line.
No problem. So what I'm going to do is I'm going to give you one GTN tablet underneath your tongue, and then that'll just dissolve. It might make you feel a bit dizzy or give you a funny taste in your mouth, but otherwise that should be fine. If it makes you feel terrible, you can spit it out.
Understood. I'll place the GTN tablet under my tongue and let it dissolve. Thanks for letting me know about the potential side effects.
No problem. So your IV line is in. Just don't move your arm there for me.
Sure, take your time.
Now that we've given you the aspirin and the GTN, can you tell me how your chest pain is feeling?
The pain is still there, but I'm hoping the medications will start to help soon. It's still quite intense, but I'm hopeful for some relief.
All right. So would you like something more for pain? We can give you some morphine. This might ease some of the pain.
Yes, I would appreciate some morphine to help with the pain. It's been quite severe.
All right, great. So I will do that for you now. Just give me a moment.
Thank you. I'm ready for the morphine.
Are you allergic to morphine? Have you ever had morphine before?
I'm not allergic to morphine, and I haven't had it before.
No problem. Thank you.
Thanks for checking.
All right, so I'm going to give you just a very low dose of morphine. We're going to just hear how you respond to that, and then we'll take it from there. Your blood pressure has been cycling, and it is still normal.
Okay, that sounds good. I'll let you know how I'm feeling after the dose.
All right, that's 2.5 milligrams of morphine, and then just a flush. So flush, and morphine's been given.
Got it. I'll wait and see how I feel. Thanks.
All right, so we can also repeat the GTN after about 5 minutes. It hasn't been 5 minutes yet. We've given the morphine, which we can also give you more because it is a STEMI. We've done your ECG. We're going to just take the rest of your vital signs, like your temperature and your sugar, and then we're going to get going to hospital. Is that all right with you?
Yes, that's fine. I appreciate you keeping me informed and taking care of everything.
Correct. I'm just going to give you a sharp prick on your finger to check your sugar.
All right, go ahead. I'm ready.
All right. All right, so your sugar is normal and your temperature is normal.
Good to know. Thanks for checking those.
All right, so we've done all our checks. We've asked all our questions. We are going to be heading off to hospital soon. I'm going to just be putting pads on your chest in case things do get worse. Do you have any further questions for us before we get going?
No, I don't have any further questions. I'm ready to head to the hospital. Thank you for everything.
Is there anything I can do to help you be more calm?
I think just knowing you're taking good care of me helps a lot. I'm feeling a bit better knowing what's happening.
Excellent. Is there anyone you would like me to contact for you?
Yes, please contact my wife. Her number is in my phone. I'd appreciate it if you could let her know what's going on.
All right, no problem. So yeah, we have done all that we need to do right now. We're going to get going to hospital now. We might be using our blue lights and sirens, so that might be quite noisy, just so you have a heads up.
Understood. I'm ready to go. Thank you for everything.
All right, so that's a wrap. Could I get any feedback on what I've done? Could you criticize what I've done and teach me something from what maybe I've missed?
You did a great job handling the situation. You were thorough with your assessments, asked relevant questions, and communicated clearly with the patient. One area for improvement might be ensuring that you consistently check the patient's comfort and emotional state throughout the process, as this helps in managing anxiety. Also, when discussing the treatment, make sure to explain the effects and side effects of medications in a way that the patient can easily understand. Overall, you managed the situation well, and your approach was methodical and patient-focused.
Is there anything I should have done that I didn't?
You covered most of the key areas well. One thing to consider is revisiting the patient's history of present illness more thoroughly if there are any uncertainties. Additionally, ensuring that you follow up on how the patient feels after administering each medication could provide more insight into their response and comfort. Other than that, your approach was comprehensive and effective.
Great. So I hope you guys enjoyed that. I thought it was quite interesting to see, how it responds and how maybe this could be used in simulations. Once again, if you did enjoy this, please hit like and subscribe. And if you have any questions, or if I maybe missed something, or if I made any mistakes, I'd love to know what you think. Bye for now.